figured out post-intubation sedation. We also just went through the advanced airway algorithm. So let's say we go through the airway algorithm and we can't get the tube, we can't ventilate them or oxygenate them with the hydrogel or anything. So we have to go to a surgical crack. So this protocol is kind of newly unrestricted. We will be doing a bit more training on it in the future. So there are many different techniques for surgical cricothyrotomy. The procedure described here is one example based on commonly available equipment, but modifications based on available equipment may be necessary. So the indication for a surgical crack is going to be the inability to oxygenate and ventilate and inability to adequately manage the airway via other means. So everybody was taught in medic class, can't oxygenate, can't ventilate, can't intubate. Those are the criteria for surgical cracks. So contraindication is going to be a patient less than 10 years. Those patients are going to need or are preferred to have needle cracks. So just keep that in mind. So preparing for the procedure, make sure you wear eye protection. Attempt to oxygenate and ventilate the patient via 2-person BVM or using supraglottic airway. Prepare your equipment. You're going to need a scalpel, so a 10 blade or an 11 blade. You need a Kelly forceps, a bougie introducer. You need an ET tube, a cuffed one, either a 5.5 or a 6.0, and a 10 ml syringe to inflate the balloon. You want to position your patient supine with the head extended. Identify landmarks by palpation. You want to identify the midline of the neck. You want to identify thyroid cartilage, and you want to identify the cricothyroid space. As far as actually doing the procedure, if time allows, apply a skin disinfectant to the proposed site of the incision. Grasp and stabilize the thyroid cartilage with the non-dominant hand. Use your index finger to palpate the thyroid prominence and the cricothyroid membrane. Make a generous vertical incision from thyroid prominence to below the cricothyroid space. Use the Kelly clamp and your finger to dissect through the soft tissue until you are able to palpate the cricothyroid membrane. Spread the clamp jaws along the direction of the incision. Use the scalpel to pierce the cricothyroid membrane and make a horizontal incision through the membrane. Use your finger to palpate the hole in the cricothyroid membrane and then insert the bougie through the incision and into the trachea. Pass the ET tube over the bougie and into the trachea just until the balloon is through the cricothyroid membrane and in the trachea. Inflate the cuff and remove the bougie. Confirm placement with waveform entitled CO2.